Do you frequently feel like your heart is racing, even when you're just sitting down? Or maybe you get tired just walking to the bathroom. Imagine your body is like a car. Cars need fuel, oil, and working parts to run smoothly. Your body needs healthy blood to work right. Blood is made in the bone marrow, a soft part inside your bones. In aplastic anemia, the bone marrow stops making enough blood cells. It's like a factory that shuts down. Without enough red blood cells, your body can't carry oxygen. Without enough white blood cells, it can't fight infections. And without enough platelets, you can't stop bleeding easily. So that tiredness, dizziness, or frequent bruises, they might not just be from being busy. They could be signs your body is struggling to make blood. What makes the bone marrow stop working? Think of it like asking, why did the factory close? Sometimes it's because of a virus, like hepatitis or even the flu, that accidentally attacks the bone marrow. Other times, strong chemicals like those in paint thinners or pesticides might poison it. Have you ever taken strong medicines for arthritis or seizures? Some of these can rarely cause this problem too. In some cases, your own immune system attacks the bone marrow, like friendly fire in an army. Other times, it's due to radiation or chemotherapy used in cancer treatment. And in many cases, doctors can't find the exact reason, which is called idiopathic, meaning we don't know yet. It's like a light bulb that suddenly stops working, and you can't tell if it's the bulb, the socket, or the power line. How do you know if something is wrong? Let us play detective. Have you noticed tiny red spots on your skin, especially on your legs? Those are called petechiae, like little red freckles that mean your body cannot form clots. Do you catch every cold going around the office? That is because your white blood cells are not fighting off germs. Are you pale and dizzy when standing up? That is from low red blood cells. Your brain is not getting enough oxygen. And if you cut yourself, does the bleeding go on longer than normal? That is a clue about low platelets. Women might have unusually heavy periods too. So, if you are feeling more tired than your grandpa at a family picnic, and your body seems to bruise like an overripe banana, it might be time to check your blood. How do doctors know it's aplastic anemia? First, they take a blood test, like checking the gas, oil, and battery in your car. If all three blood cell types are low, they get suspicious. Then they do a bone marrow biopsy. Don't worry, it's not as scary as it sounds. They numb your hip and take a tiny bit of the marrow with a small needle. If it looks empty, like a closed-down workshop with no workers, that confirms the diagnosis. Treatment depends on age and how serious it is. For mild cases, doctors might just watch and give you medicine to help your immune system behave. For severe cases, the best fix might be a bone marrow transplant, like replacing a broken engine with a working one, often from a family member. If no donor is available, they use immune-suppressing drugs to stop the body from attacking itself. Some people also get blood transfusions, like getting a temporary battery boost, until they recover. Can we stop aplastic anemia before it starts? Not always, because sometimes it's like a lightning strike, random and unpredictable. But we can reduce risks. Avoid unnecessary exposure to strong chemicals, like pesticides or benzene, found in some glue, paint, and cleaning products. Always use gloves and masks if you're working with these. Don't skip protective gear if you're in certain jobs like painting, farming, or mechanics. If you're on medications that rarely affect bone marrow, make sure your doctor checks your blood regularly. Also, protect yourself from viruses, wash hands, get vaccines. While not all cases are preventable, being careful is like wearing a helmet while biking, just in case. Scientists are always searching for better ways. Imagine a tiny robot that can fix your bone marrow. That's not here yet, but new research is exciting. Doctors are testing new drugs that help the bone marrow wake up and start working again. One drug called eltrombopag, originally for platelets, is now helping boost all three blood cell types in some patients. There are also gene therapy studies, trying to fix the broken signals in blood cells. And researchers are improving transplant success by using parts from partially matched family donors, not just perfect matches. Stem cell research is growing too. Labs are trying to grow new bone marrow in a dish. While these aren't standard yet, they're like GPS updates for medicine, helping doctors